Simplified explanation: Acyclovir, Valacyclovir, Famciclovir. These antiviral drugs are guanosine analogues. They are activated only in infected cells by an enzyme called viral thymidine kinase, found in HSV and VZV. Once activated, they stop the virus from making DNA by blocking viral DNA polymerase and causing chain termination. They are not effective against CMV, which lacks the necessary enzyme for activation. Valacyclovir is a prodrug of acyclovir with better absorption. Famciclovir is used especially for herpes zoster. Main uses: HSV genital lesions, HSV encephalitis, VZV, shingles, and prophylaxis in immunocompromised patients. Side effects: kidney injury from crystals if not well hydrated. Resistance: mutations in viral thymidine kinase. USMLE style question 1. A 29-year-old woman presents with painful genital ulcers. HSV-2 is confirmed by PCR. She is prescribed oral Valacyclovir. What is the mechanism of action of this drug? A. Inhibits viral protease. B. Inhibits reverse transcriptase. C. Blocks DNA chain elongation by inhibiting DNA polymerase. D. Inhibits RNA-dependent RNA polymerase. E. Neutralizes viral envelope glycoproteins. Correct answer: C. Blocks DNA chain elongation by inhibiting DNA polymerase. Explanation: Valacyclovir is a prodrug of acyclovir, which is activated in HSV-infected cells. It inhibits viral DNA polymerase and terminates DNA synthesis. Why not the others? A. Protease inhibitors are used for HIV or HCV, not HSV. B. Reverse transcriptase inhibitors are for retroviruses like HIV. D. RNA polymerase inhibitors are used in RNA viruses like SARS-CoV-2. E. Envelope neutralization is the role of antibodies or entry inhibitors, not acyclovir. USMLE style question 2. A patient with shingles is prescribed Famciclovir. 2 weeks later, his symptoms improve. However, a new patient with CMV retinitis is given the same drug and shows no improvement. Why is Famciclovir ineffective against CMV? A. CMV has resistance to DNA polymerase inhibitors. B. Famciclovir is not active against RNA viruses. C. CMV lacks the thymidine kinase required to activate the drug. D. CMV replicates only in the nucleus. E. Famciclovir cannot cross the blood-brain barrier. Correct answer: C. CMV lacks the thymidine kinase required to activate the drug. Explanation: Acyclovir and its relatives need viral thymidine kinase for activation. CMV does not produce this enzyme, so the drug remains inactive. Why not the others? A. Resistance can happen, but this is not the main reason for ineffectiveness here. B. CMV is a DNA virus, not an RNA virus. D. Many viruses replicate in the nucleus, but this doesn't explain drug inactivity. E. Blood-brain barrier crossing is irrelevant for CMV retinitis treatment with this drug.